Today we will discuss about a topic called as cranio-vertebral anomalies. So as the name indicates, first we will understand what is cranio-vertebral anomaly. So as we can see the cranium here and the vertebra. So some deformities at this level. To list such deformities, we can consider from above downwards. So first one is, we call it as platybasia. Platybasia. So what happens here is, there will be this angulation between the cranium and the vertebra. So this angulation will be increased. So increase in the angle of base of skull mainly. So this is the first one. Then second one from above downwards is basal invagination, we will say invagination. That is, posterior cranial fossa will be slightly elevated upward. So this is called as basal invagination. This is the second one. Third one, we can consider occipitalization of the atlas, that is first cervical vertebrae. So occipitalization of atlas. Fourth one, these both C1, that is first cervical vertebra and second cervical vertebra, also called as atlas and axis, they will get dislocated. So atlanto-axial dislocation can lead to cranio-vertebral anomalies. Coming to the fifth one, you might have heard about clipal flea syndrome. That is fusion of the cranial vertebrae. So this is fusion of cervical vertebrae. And to list one more is Arnold-Chiari malformation. Arnold-Chiari. So these are some anomalies of craniovertebral junction. So what will be the manifestations of such anomalies at the level of this junction? How the individual will manifest? So often these individuals might not be having any symptoms at all. So they might be asymptomatic in some cases, but if they present with some features, there can be, first one is something called as Fields triad. So that is nothing but, here we can list out the things. That is, there will be low hairline plus short neck, and there will be restricted movements of the cervical vertebra. Restricted movements of cervical vertebra. So these three things will form Fields triad. Other manifestations might be, there might be features of cerebellar dysfunction. So cerebellar signs we can see, and there will be spastic quadriparesis. There might be wasting of small muscles of hand, hands. So these might be some manifestations in craniovertebral anomalies. Now the question to you is, when we call an individual as having low hairline, and what is short neck? So I am expecting the answers in comment section. What is low hairline and what is short neck? So this is a short note about craniovertebral anomalies, one of the important topics when it comes to neurology. Do read more about it and please answer the questions in comment section. Thank you.